Hi, welcome everyone to Tech Service Today's live webinar on the best practices for IT rollouts in the dental and vision industries. If you are just joining us and would like to ask a question at the end of the webinar, make sure to enter the audio code so we can unmute you. And we're just going to start in a few minutes. Thank you. Okay, everybody, we're going to go ahead and start. First off, welcome and thank you for joining us. My name is Susan Kremen, and I'm the Director of Marketing with Tech Service Today. I would like to introduce you to our VP of Business Development, William Hull, who will take you through the best practices for IT rollouts in the dental and vision industries. William brings over 20 years of project management experience in a variety of industries, including IT infrastructure, healthcare, restaurants, hospitality, retail, and performance improvement. William also holds a master's certificate in project management from the George Washington School of Business. And I'm now going to hand it over to Will.
Good morning or afternoon, everybody. I hope everybody's having a great day out there. Thank you very much for joining us. Wanted to let you know, as you can see from the slide, originally Travis Taylor, who is the fellow that handles our accounts for the healthcare vertical, was going to be on this call, but unfortunately he is ironically down with the flu and out of the office today. So I will be your host today. As Sue indicated, I've got a lot of experience with running IT project rollouts, and I head up business development here at Tech Service Today. So today we're going to be talking about IT rollouts specifically in dental and vision offices and clinics. There are certainly some specific issues that come up with IT projects in these environments that you don't just find in any environment. Anytime you're dealing with a medical environment, we've got some extra things that we need to talk about. So that's what we're going to do today. We are going to keep this to about 20 minutes or so for the presentation and then open it up for questions at the end. You'll be able to either, I'll unmute everybody and you can ask questions that way, or if you like, you can ask questions in your little sidebar on your GoToWebinar. You can also send a text message via that to myself or Sue. Either way you want to do it is fine with us. All right, so let's go ahead and get started here. Don't want to take up too much of your time. We know you're busy. So the first key to any kind of IT rollout project is really the same key to any kind of project you do, whether it's IT or not, and that's making sure that you're planning in advance. Too often we see companies coming to us really at the 11th hour wanting to do a large rollout project, and problems tend to ensue when people wait until the last minute to think things out. Whether it's upgrading equipment at your office, doing a new version of an operating system whatever it might be, you really have to plan ahead with these projects. You don't want to wait until the last minute. As the project rolls out, your ability to control what happens decreases and your costs increase. And that's the importance of planning up front. So I'm going to show you a slide that you probably have already seen a million times before. I've seen this, I can't count how many times in these project management books or project management courses. I've seen this very standard chart that shows you in orange the amount of control that you have over a project. The green is the capital expenditure, the cost of the project, and time starts at 0 at the left-hand part of the chart and goes up at the right-hand part of the chart. And the point of this is that at the beginning of a project, you haven't spent any money, you've got a lot of control over what's going to happen because you're going to define the scope, you're going to define the schedule, you'll figure out your budget, you've got all kinds of control. As time rolls on, and given the arrow of time only goes in one direction, inevitably you're spending money and resources, and the decisions you make affect what you can do from that point on. So your control over what's happening with the project reduces over time as costs mount. So it's critical that you plan in advance, and it's critical that you do good risk analysis. You want to be looking for potential problems. You want to avoid rose-colored glasses and thinking about what the best case scenario is. It's tempting to do that because usually we want to tell the business sponsors of a project that we can do a project really fast and really cheap. We're all going to get feathers in our caps if we can do projects really cheaply and really quickly. The reality is, though, that you've got to be able to provide the required scope in a realistic time frame and with a realistic budget. And planning is key to making sure that we're going to be able to realistically deliver on what we promise. One of the keys when we're planning on our projects is ensuring that we've got detailed instructions and instruments. Too often, again, people tend to wait until the last minute to get these together. And they also have a tendency not to validate these documents with people that are out in the field. One thing to remember is that you who live in the central IT department, usually at your headquarters or something like a headquarters at your company, you are the most familiar with your systems of anybody because you use them every day. Your help desk people, your applications teams, you know it better than anybody. So your field technicians or the technicians for a third party that you're using out in the field aren't as familiar with it as you are. So it's critical that you've got instruction documents that are detailed. The more photos and diagrams with labels, colors, arrows pointing, the more you can give people a visual representation of what they're going to see when they get to the site and what they need to do, the better. It's also a really good idea to have a frequently asked questions section. Think up for yourself, what are some questions that you found people in the past have about it or you think reasonably a person would ask, and make sure that those are included in the document. And another good way to develop this section is by running a pilot, which we'll talk about in a few slides. By piloting, you can keep a list of what questions technicians are asking in the field and then have a section of it so that those are answered for them. And of course, you want to validate these documents with technicians in the field. What we find is that what makes perfect sense to us and our project managers, what may also make perfect sense to you and you guys on your help desk, may not necessarily make as much sense to somebody out in the field, and that's why it's always good to validate it with somebody out there. You never want to take anything for granted. Another critical element of making sure that your rollout happens smoothly is ensuring that the sites are prepared. There's nothing worse than a technician rolling out to a site, showing up on time with all the documents and equipment that they need, only to discover that there's no one there. And in almost every project that we run with companies, inevitably there's at least one time in the project where somebody didn't get informed, and we have a technician standing there ready to do the work, and your help desk is ready to do the work, and somebody at the site has forgotten about it, there were wires crossed, and the technician can't even get access to the building, and they're standing waiting around for them, and it may have to be postponed, it may extend the time. All of that makes for more use of resources both internally and if you're using a third-party vendor, increased costs. So making sure the site is prepared is absolutely critical. It's really important that the on-site personnel, especially the management, understand the importance of the project and how it's going to improve their work lives. Getting buy-in from the people at your non-headquarters locations is going to mean that they're going to buy into the project. They're going to be committed to the project. So it's not just a question then of simple project management. There's an element of change management more broadly, meaning you're showing people how you're changing processes, how they're going to help them out, why it's important. And so it's good to have a conference call or video conference. And what's really effective, we've found, is when this meeting is run not by IT or just by somebody in IT, but when it includes somebody from the business unit and an executive from the business unit talking about the importance of the project, talking about the business reasons for the project, and again, how it's going to help the people that are out at your clinics, out at your offices to do their work on a day-to-day basis, how it's going to improve patient care, how it's going to improve revenue, whatever the point of the project is, helping them understand what the big point is, because that will help them be committed to the project rather than just seeing it as some irritant that they have to deal with. The other element that you need to make sure that you've taken care of is ensuring that the necessary equipment is on site. So usually you're going to be coordinating with a third-party vendor, whether you're configuring the equipment yourself, you're having a third party configure it and get it out to the sites. You have to make sure that it has arrived on site, and it's important that you have a consistent location, secure location where the equipment is going to be stored, and it will be available for the tech or techs when they arrive on site to install it, to deal with it, whatever it might be. And I emphasize secure. We have certainly seen instances where equipment has a way of disappearing between when it's delivered and someone has signed for it, and then our technician shows up to actually install it. Particularly, we have seen this be a problem with wireless access points. For whatever reason, they seem to be popular things. Items for people, probably because it's the one piece of equipment that network equipment that sort of common individuals can relate to in a way in which they can't relate to, say, a router or a switch or just a hard drive. So it's important that it be in a secure location. It's also critical that there are reminder emails and phone calls made to the sites themselves, even after you've had a kickoff meeting, to keep them in the loop so that they know when the technician's going to be there and what they need to do and where they're supposed to allow the technician to be. I can tell you that at medical facilities, people do not respond well to just somebody showing up in a truck with some cable in their hand saying, "I'm here to do the work." If they don't know what it is, they're certainly not going to let that person on site and not let them into offices for obvious reasons. So it's important that you've got the right people on site with whatever keys or codes they need to get the technician where they need to be, let them know where the equipment is so they can get to it, and that they're early for it. It's always critical that they're early, because the last thing you want to do is have either your help desk sitting around waiting or your field technician sitting around waiting for somebody at the site to get their act together. So again, and that of course is a good thing to emphasize in your first call when you're doing the kickoff meeting for it, making it very clear what the expectations are of people in the field. Now, you guys are all probably even more familiar with this than we are here at TST, but just as a reminder here, HIPAA is the one piece of the puzzle that other parts of the IT world don't have to deal with. And HIPAA is a very strict regulation. There are monetary and criminal penalties for violating it, so it's critical that you consider this in any kind of IT project, obviously, because you need to protect the information and the privacy of your patients at all times. As you know, there are massive legal liabilities, both for individuals and for companies, if these are violated, not to mention the loss of trust, the good faith, patients' privacies, and as you all probably know, from the standpoint of identity thieves, healthcare information is the most valuable information out there. It's even more valuable than credit cards. If people have medical information, they can create fake scripts. There's a thriving underground industry in all sorts of prescription pharmaceuticals, particularly narcotics and OxyContin and this kind of thing, where people are making vastly more money off of faking people's healthcare identities to get scripts and then selling those on the black market, even more than if they got somebody's credit card information. So this data is very sensitive, as you well know. So a few things to understand about HIPAA and professionalism in the medical clinic environment. Obviously, I'm sure your help desk people, your internal IT staff has got a full understanding of HIPAA laws. Likely you've got annual trainings on this topic that everyone must attend, and it's important, therefore, that your field technicians are up to date on this as well and understand it. And so if you're using a third-party vendor like Tech Service Today or whoever you're using, they need to be familiar with it. They need to have experience with running these projects in the healthcare environment because it is a different environment than, say, a retail store or a restaurant or a manufacturing facility because of these laws. It's also critical that these technicians go through background checks. I mean, it's a good idea just in general, but particularly when you're dealing with such sensitive data, you obviously have to be very careful from a liability standpoint of ensuring that the technicians have gone through background checks. It's also depending on the environment. There may be a necessity for immunizations. Now, in the dental and vision world, this usually isn't as much of an issue as it is in hospitals, but it does depend on the particular operating environment that you're involved with. And again, you want to make sure that you're dealing with a company that's got experience with this and has documentation on it if that's important for you. And the final piece of this is not so much about regulations. It's not about the law. It's not about the government. It's about the nature of medical facilities. When people go into a clinic for something that's related to, their eyes and their mouths, these are very intimate parts of people's bodies. And people are very sensitive about it. So privacy is not just an issue of the regulation and what's in a file. It's also about how you interact with people on a day-to-day basis when you go to a clinic. And so it's important that the technician that's going to show up in the clinic is going to be properly dressed, that they're going to have closed-toed shoes, that they're wearing khakis, that they're wearing a collared shirt, that they look professional, just like you, of course, insist that all your clinic personnel look professional. It's important that your technicians that show up to do the work look professional as well. Because let's face it, there can certainly be issues in the low voltage world where a guy comes up to sling cable and he's sweaty and he's got lunch on his shirt and he just doesn't look presentable and professional. And it's important that you're working with people in the field that get the importance of looking right. It's also important that they understand that the kind of friendly sociability that might be appropriate in other environments is not appropriate in a medical environment. If you go in to get eyeglasses, your eyes checked, you're going in to get in dental work, you're not really interested in striking up a conversation with a technician that's there to say swap out a hard drive. They have to understand, the technician needs to understand that it's not their place to be chatty Cathy. They're there to do a job. They're there to interact with the designated site contact, but they're not there to engage your customers, your patients in conversations, because essentially that's a violation of their privacy. And it's really important that they understand that. So professionalism is key in terms of how they look, how they interact with, and of course, having the technical knowledge and the professionalism to show up on time. The last thing you need in a project is for it to get hung up because you're waiting for a technician to show up. That's simply unacceptable. Oops, went the wrong way. Split sites are really the #1 way to ensure that your project is going to go smoothly. We see every year, because we do hundreds of projects for customers every year all across the U.S. and Canada, and inevitably customers who refuse to run pilot sites, which is usually a function of not having done enough planning at the front end, not having scheduled enough time, when they fail to pilot, it is almost inevitable that they're going to miss at least one of their goals in terms of the budget, the schedule, or the scope. One of those targets typically gets missed if somebody doesn't pilot the project. It's important to take, it depends on the size of the project. If it's about 10 sites or so, I'd say you want to take at least 1 site, 2 sites to pilot it before you roll out to the others. You know, it depends on the complexity and size of the project. We certainly have seen projects where, you know, when we're talking about, 2,000 plus sites, where customers are taking a week and piloting 20 sites at the very beginning. It really depends. There's no absolute, number for it, but it's something you want to think about. And you want to make sure that when you're picking sites for your pilots, that they're have some differences between them, some different geographies, different setups. Depends on whether your clinics have a given set or whether they tend to be heterogeneous. Frankly, what we see most of the time in the dental and vision world is that, especially because, most companies are growing through a lot of acquisitions in addition to opening their own offices, there can be a lot of different environments. So getting a mix of office setups is helpful to get a sense of what's happening out there. And what the pilot does is it helps you really with your risk mitigation. You're ensuring that your instructions are effective to people out in the field. Remember on the first slide I was talking about the importance of having good written, good visual instructions. This is a way to validate those. And it helps you find unforeseen problems, finding things that you didn't think about or that your project team did not think about. I'll give you a good example. Last year, we were doing a Wi-Fi access point swap out for a large company that you all know of, but I won't mention them because I'll keep the names private to protect the guilty in this case. And they had scheduled a swap out, and they were estimating that it was going to take about 15 minutes per location. The thinking was, well, you just go, you unplug the existing Wi-Fi point, you put the other one in its place, you plug it in, you screw it back in, you call our help desk, they make sure that they've got a green light, that it's on the network, we can see it, and there they go. At most, it'll take half an hour if there's some kind of connectivity that we need to troubleshoot. Well, we told them we didn't think that this was realistic, but they insisted that it was. They got really just a couple of days into the project, and what they discovered was that what they hadn't thought about was that almost all of these access points were placed above drop ceilings, and they did not have any photos or diagrams of where these were located. So unless somebody at the site knew where they were, and given that they had been placed several years earlier, that was pretty unusual, our technicians were having to walk around with their their phones or their laptops or their iPads, trying to use their signal meter for Wi-Fi to find the signal, popping tiles, looking around for them with flashlights. It was very time consuming. We found that just finding the access point itself could take 15 minutes. In some cases, it would take an hour, depending upon the particular configuration of what was going on. Then what they discovered, in addition, was that once they had found the access points, that some of the access points they hadn't, for whatever reason, they had not noticed, were not showing on the network even before they replaced it, because they had a bad jack or a bad cable. And so that basic infrastructure work had to be done before they could actually swap out the access point effectively. And then they ran into some additional problems with some configurations, getting them to show up on the network. So after really just a few days, they shut down the rollout because they discovered these problems. And what's so bad about it is that, had they done a pilot, even just for a couple of days, they would have found what they would have found this, they would have planned for it, they could have made some changes. Instead, they had to bring the project to a screeching halt, to scramble to change the way that they were doing things, to get information, try to get information about where the access points were located, and it ended up delaying the project by 2 weeks. It was just the way it went in order for it to happen effectively. Had they piloted it, they would have been able to quickly assess these problems. They would have had some time in between the pilot and the full rollout to make some adjustments, and it would have gone a lot more smoothly, and the business unit sponsors would have been more happy with it. So it helps you find unforeseen problems. It also makes sure that your central help desk staff, as well as on-site people, understand the SOW, they understand the troubleshooting. Again, you can revise the instructions, you can revise the procedures before you roll it out. And of course, the other piece of it is that it helps you really accurately estimate your completion times. Too often, people create time expectations on projects based simply on budget. They say, well, we can afford 100 hours of field time for this, therefore, and it's 100 sites, therefore it should take an hour. And I will be honest with you, whenever somebody comes to us and says, it should take this long, my antenna go up, because what something should take, which is to say what you would like it to take or what we would hope it would take, and what it takes in the real world can be very divergent. And with the last example I gave you, although that they said it should take 15 minutes, and in a perfect world, you could see how that would take 15 minutes to swap those access points out. In reality, it averaged an hour and a half per site once all the different pieces of it were taken into consideration. That's a pretty big delta between 15 minutes and 90 minutes on average. So it's important to use pilots as a way to validate your estimated completion times so that you know you're scheduling and budgeting properly. So when you finally have, you've piloted and you're ready for this, scheduling the full rollout, a few other things that it's important to keep in mind. One is that you want to make sure that you've got sufficient coverage at your central help desk to handle all the call-ins from your field technicians. And again, this is why pilots are very important, so that you get a realistic sense of how much time it takes, because there's nothing worse than having, let's say, 30 or 40 techs out on the field on a given day, and if you've only got a couple of people on your help desk, they can get backed up really quickly. Because what you want to make sure is that you're staffed so that your field technician, when they call in, ideally somebody's answering their call immediately. It doesn't have to go to voicemail. If it does go to voicemail, you want to be calling that person back within a matter of minutes, because every minute that they're standing out there by themselves is costing you money, and it's slowing down the schedule for the project to be completed. So you want to make sure that you've got the right amount of staff at your central help desk. You don't want too much, you don't want too little. Also, be mindful of time zones. Sometimes people forget that 8 o'clock in the morning on the East Coast is 5 a.m. on the West Coast, and there have been some instances where some companies have forgotten about this, and people haven't shown up at the right time, or they've gotten a lot of pushback because people don't want to be showing up at 5 a.m. to let a technician in to do the work. So it's important to keep that in mind. It seems kind of obvious once you've mentioned it, but it isn't always obvious, which is why I mention it. Again, you want to be realistic about your completion times based on the pilot site results. Avoid the quote-unquote "it should take" trap. It should is a way of saying I would like or I hope, and remember, hope is not a strategy, so it needs to be grounded in reality. And then the other thing that we recommend that you do is plan for an additional 10 to 20% extra time on average to deal with problems that are going to pop up to the site. That way you're not jamming your schedule too hard together, and you've got your techs in the field able to call in, call out, deal with everything. It's better to have a little bit of breathing room rather than just stacking everything up right on top of each other, because you don't want to overwhelm your central help desk and have the people out in the field standing around waiting for testing or to check in or check out or whatever it might be. And the other thing to remember with that is that, you know, of course, the goal is to have everything happen under schedule. And when you're dealing with a third-party provider, it's really good to deal with somebody that's going to charge you based on actual time on site, so that if you're able to get it to happen faster, you know, you're not paying extra money for that extra time. And that's the pricing model we use at TST, so that, you know, if it goes faster than planned, you're paying less than you planned. And everybody wins when these projects come in under budget. Okay. Well, I've been talking for about half an hour, so it's time for me to shut up, and I'm going to open it up for any questions. I'm going to unmute anybody, so if you'd like to chime in, also you can type in under the questions bar or send a text message, and we can answer your questions. So going to open it up the floor. Okay, one hearty soul has, okay. Okay, so the question is, what do you recommend in terms of closeout documents, how to handle? Okay, good question. With any of these kind of rollout projects, inevitably you're going to have some kind of site checkoff form. Usually there'll be a timesheet that needs to be filled out. There may be a checklist, a completion checklist, a testing checklist that you want the you know, the site contact to fill out. What we recommend is that when you have the technician on site, simply take a picture of that document and send it into your help desk. Now, what we do at Tech Service Today is we require photos to be taken of all completed work. We have some customers of ours actually that require us to do a visual inventory of their network room and related equipment on every visit, which is actually a very good idea, because, you know, things have a way of changing out in the field to change configurations compared to what you're expecting at headquarters. And in any case, what we do is we have a online web portal that our customers can log into at whenever they want, 24/7. We upload all the pictures and diagrams to the web portal, and they can either just be kept there, or what a lot of our customers do is download it into their own SharePoint portal or whatever kind of knowledge base that they've got for each of their locations. So we really recommend that. And again, I really recommend having the technicians just take a picture of the documents rather than having to bug somebody there at one of your clinics to use their fax machine or scanner and email it. It's really just, I mean, everybody's got a smartphone with a camera these days. It's really just easier to have the technician take a picture of it and send it off. The one little tip about that is that, you know, typically they don't need to use the highest resolution. You really don't need a 15 or 12 megapixel picture of your of your simple sign-off sheet to get it back, and that data does start adding up. So it can be a good thing to remind the techs to use a lower resolution setting on that. Just a little minor point, but it can save you a little headaches, especially if your email system is set up that it won't accept large attachments. So it's a good way to deal with it. Okay, good question. Any other questions out there? All right, very good. Well, really appreciate everybody's time and attention. Here is the contact information for Travis and myself. Feel free to reach out to either of us if you've got any questions. We have recorded this webinar, and you'll be getting a follow-up email from us once we have it uploaded, and you'll be able to download it, take a look at it, share it with friends, whatever. We hope this has been helpful for you. There's certainly a lot of other things that go into these projects, but we wanted to give you a taste of what we found are the highlights of things you want to cover. But again, feel free to reach out to Travis or myself at any time, and we'd be happy to provide you with our perspective on things. So again, thank you very much, and we hope you guys have a great rest of your day, and we really appreciate your attention.